This is San Joaquin County Public Health Services. In this presentation, we will be discussing COVID-19 coronavirus. Viewership Agreement. The following video is intended for informational and educational purposes only and should not replace the advice of a qualified professional. It is not intended to be a substitute for professional advice, whether medical, legal, or otherwise. While efforts are made to verify the information presented at the time this video was recorded, given this rapidly changing situation, all statements presented in this video are subject to change. As a result, Public Health Services does not guarantee the accuracy and/or completeness of the information in the following video. By viewing this video, the participant agrees that he or she is participating of his or her own free will and hereby releases the County of San Joaquin, its agents, employees, and board members of all liabilities arising from viewing this video. For data on COVID-19 cases for San Joaquin County, they can be found on sjcphs.org. There, you'll be able to find the latest updates on the total number of cases, hospitalizations, and deaths that are updated daily. How does coronavirus spread? The virus mainly spreads from person to person, between people in close contact with one another through inhaled droplets, such as talking, sneezing, or coughing, and by touching your face after touching infected surfaces. Some of the most common symptoms for coronavirus include fever of 104 degrees Fahrenheit, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. It's important to keep in mind that an individual with COVID-19 can present with all of these symptoms, some of these symptoms, or none of these symptoms. Prevention. One of the most efficient ways to prevent the spread of coronavirus are to wash your hands, washing them often with soap and water for at least 20 seconds, or using hand sanitizer that contains at least 60% alcohol when soap and water aren't available. And try to avoid touching your eyes, nose, and mouth with unwashed hands. Avoiding close contact. It's important to avoid close contact, especially with other people who are sick. Practice social distancing by maintaining yourself at least 6 feet from other people and staying home if you have respiratory symptoms or a fever. Try to avoid shaking hands, hugging, or other intimate greetings with others. It's important to remember to cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw away used tissues in the trash, and immediately wash your hands with soap and water for at least 20 seconds, or with hand sanitizer with at least 60% alcohol when soap and water aren't available. Clean and disinfect frequently touched surfaces daily. If surfaces are dirty, clean them with soap and water. Use gloves when picking up used tissues or emptying waste baskets. Linens, eating utensils, and dishes do not need to be cleaned separately, but should not be shared without a thorough washing. Reduce the spread. As directed by the state of California, a face covering is now required in all public spaces. For complete face covering guidance from the California Department of Public Health, please visit www.cdph.ca.gov. A few tips for safe face covering use include cleaning your hands before and after touching the face covering, removing and storing the face covering before eating or drinking, washing used face coverings with detergent and hot water and then drying them on a hot cycle, storing used face coverings in a bag or bin until they can be laundered. It's especially important that you always cover your nose and mouth when using a face covering. Use a securely placed bandana, scarf, or homemade cloth cover. And avoid touching the face covering. It should not hang on one ear, around the neck, or be pushed to the forehead. Please avoid sharing personal items with others. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding. Wash thoroughly after use. After using these items, wash them thoroughly with soap and water, or put them in the dishwasher or washer, and try to avoid any contact with your pets and animals. It's important to postpone all social gatherings of any kind. This includes meeting with friends, extended family members, or anyone that does not reside in your household. It's important to continue monitoring your healthcare if you have chronic conditions such as diabetes, high blood pressure, asthma, and heart disease. Please do not be afraid to access your regular healthcare provider for preventative care services. Call 911 if you have a medical emergency, and notify the operator that you think you might have COVID-19. If possible, put on a face covering before medical help arrives. Statewide, there are 4 stages to reopening of California. Opening and closing of sectors are subject to change per state guidelines and health officers' recommendations. For the latest updates on sectors that are open or closed in San Joaquin County, please visit our website at sjcphs.org. For additional guidance for reopening of businesses, you can send an email to sjreadyfeedback@sjgov.org. To ask health-related questions or concerns, you can email phs-info@sjcphs.org. And for the latest updates and resources, please visit our website at sjcphs.org. Thank you.